Hello friends, today we will learn about hypersensitivity. First of all, what is hypersensitivity? As the name suggests, hyper means excessive or exaggerated. So, any exaggerated immune response is known as hypersensitivity. But this is a misnomer. Sometimes a normal immune response is also known as hypersensitive. So, how will we decide which immune response is hypersensitivity? Tissue destruction. There must be tissue destruction. So, once again, what is hypersensitivity? Any immune response, whether normal or exaggerated, if it causes tissue destruction, it is known as hypersensitivity. It is classified into four types. Type 1, also known as immediate hypersensitivity. Type 2, antibody mediated hypersensitivity. Type 3, immune complex mediated hypersensitivity. And type 4, cell mediated or delayed type of hypersensitivity. Now, type 1 hypersensitivity or immediate hypersensitivity. Before that, what is atopy? Atopy means increased propensity to develop immediate hypersensitivity, meaning some individuals have higher chances of developing type 1 hypersensitivity than the rest of us. So, what are the factors that decide this? One is MHC class 2 molecule and another is HLA gene present on chromosome number 6. So these are the factors responsible for atopy. Now coming back to hypersensitivity, first step in hypersensitivity is sensitization. It is making our immune system capable of generating an immune response against a particular antigen. Let's see how this is done. First of all, an antigen or allergen enters our body and it binds with antigen presenting cell, which in this case can be a macrophage. So antigen will enter our body and it will bind to antigen presenting cell. The antigen presenting cell will present it to T cell, which will lead to T helper 2 cell activation, and which in turn will release interleukin 4, interleukin 5 and interleukin 13. Interleukin 4 here, it recruits IgE antibodies, interleukin 5 recruits eosinophils, and interleukin 13 increase mucus secretion. So let's see in detail how this recruitment of IgE antibodies take place. See, when an allergen or antigen enters our body, it not only goes to antigen presenting cell, but it also goes to B cells. Now, when this antigen presents itself to B cell, it leads to production of interleukin 4 receptors. Now these interleukin 4 receptors, these interleukin 4 receptors will be presented on the cell membrane of the B cells, and the interleukin 4 secreted by the T helper 2 cells will then bind to these receptors. Now this binding of interleukin 4 receptors with interleukin 4 leads to the production of IgE antibodies. Now these IgE antibodies, they are anti-antigen, meaning these IgE antibodies are produced against these antigens. Now that these IgE antibodies are produced, they will go and bind to the Fc receptor on mast cell. Now what are mast cells? See, like in blood, we have basophils. Mast cells are the counterpart of basophil in our tissue. They have Fc receptor which have an affinity towards IgE antibodies. So IgE antibodies that are produced against these antigens, they will go and bind with the Fc receptor present on the mast cell. And after this binding has taken place, this mast cell is now sensitized. So it is sensitized against this antigen. Now it will be known as sensitized mast cell. So now once our body is sensitized against an antigen, it is now capable of generating an immune response against that antigen. So when this allergen will re-enter our body, it will bind with the IgE antibodies present on the mast cell. and immune complex formation will take place, that is polymerization. So where this polymerization will occur, it will occur on the mast cell, since the antibodies are present on the mast cell. So the polymerization will occur on mast cell, on the sensitized mast cell, which will lead to its degranulation, and degranulation in turn will lead to early phase reaction and late phase reactions. Now what are early phase reactions? These are reactions that will occur within 30 minutes. It takes usually 1 to 2 minutes, or they can occur within 30 minutes. So why these early phase reactions occur? These occur due to preformed mediators, meaning these mediators are already present in the mast cell, in the vesicles, and when the polymerization occurs on the mast cell, its degranulation leads to their release. Now what are preformed mediators? Some examples of these preformed mediators are vasoactive amines like histamine, enzymes like trypsin, proteoglycans like heparin. And what are their effects? So it will lead to vasodilation, increased vascular permeability, meaning edema, and smooth muscle spasm like bronchospasm. So in early phase reactions, due to these mediators, we will see these effects. What effects? Vasodilation, edema, and smooth muscle spasm. Now, what are late phase reactions? These are reactions that will occur within 2 to 24 hours, and they persist for they can persist for 2 to 3 days. So these late phase reactions, they occur due to newly synthesized mediators, meaning when the degranulation occurred, these mediators, their synthesis started then. Okay, so what are these mediators? Leukotrienes, prostaglandins, chemokines, and cytokines. And what are their effects? Epithelial destruction, tissue destruction, leukocyte infiltration. So see here, epithelial destruction and tissue destruction is here. So what we learn, in any immune response, if there is tissue destruction, it will be known as hypersensitivity. So this is type 1 hypersensitivity, in which tissue destruction and epithelial destruction is occurring due to these antigen. Now coming to non-atopic allergy. What is non-atopic allergy? Hypersensitivity by non-antigenic stimuli, meaning no antigen is involved in this hypersensitivity. So like you must have heard, some people are allergic to extreme temperatures or exercise. So this is known as non-atopic allergy, and it does not involve any T helper 2 cells or IgE antibodies. And what is hygiene hypothesis? Hygiene hypothesis is increased incidence of allergic disease due to decreased infection in early life, meaning nowadays cases of allergy are increasing in hospitals. Why? Because since people are more aware about sanitization and hygiene, the small children are not exposed to various antigens which are present in the environment. So their immune system is not properly developed to fight against those antigens or allergens which are later on faced by them. So it causes increase in hypersensitivity cases. This is the hypothesis known as hygiene hypothesis. So that's all for today's topic, guys. Thank you for watching. Give this video a like, share, and subscribe to my channel Medically Simplified. Press that bell icon for latest updates. Thank you.